All right, well, my next guest today on the Texas Tea podcast is the absolutely most dynamic duo in dentistry and the reason why my teeth look so good personally. Dr. Bob and Kim Stewart. Thanks for coming on today, guys.
Thanks for having us.
Yeah, of course.
Appreciate
Thank you
it.
for matching. By the way.
You're very kind. Thanks for inviting us.
Yeah, if I knew, I would have wore pink too. I think we're a little too soon for Breast Cancer Awareness Month. What is that?
A little
October?
bit. October, I think, yeah.
But
it's okay.
bringing the awareness soon.
Yeah.
So yeah, I think when we originally met, when I lived in Pasadena, what was that? 4 years ago? No, it was more than that. 5 years ago.
Mm-hmm.
5 years ago, and I did not at the time know that you guys were married. Yeah, but what always appealed to me was both y'all. Whenever I saw you, I don't think I ever saw you stressed when I came in.
We hide that well.
Yeah.
Good. That's good to know. Okay.
But always beaming with happiness. Obviously, beautiful smiles.
You're kind.
But I'd like to hear you guys' story because you have two locations, one in Pasadena, one in Willowbrook, or
That's
off
correct.
of Willowbrook?
Yeah, it's right across from the mall there on 1960.
I got you. How did Bless Dental start, and what were some of the tribulations? Tries and tribulations? I always forget that term that you guys went through. Definitely want to hear the come-up story of Bless Dental. Come-up story of the Stewarts.
So should you start or should I?
Go for it.
Okay, so I graduated from dental school in '88.
Okay.
And then I worked as an associate for one of the big groups for about 3 years,
Okay.
which was great because I learned a lot of things. You know, you come out of dental school and all the terms are flying around in your head, or at least in mine.
Yeah.
And I knew all the answers, but it takes a little bit to put them all together.
Okay.
And so it's kind of from a technical standpoint, as my career went through the years, I reached a moment where I realized that I was no longer having to think about things that I had done there, been there, done that, seen that, and it just all came together. And that's really a great moment in a dentist's career when it's like, okay, I know what I'm doing.
So like an athlete, you kind of created like a muscle memory for every procedure and every piece of knowledge.
That's a good analogy. I like that. But yeah, it just kind of came together. So that was technically. And then business-wise, so after about 3 years, I took over a practice there in Pasadena.
Yeah, okay.
We were living in Clear Lake, just a little bit south.
What was the practice before Bless Dental?
The practice, it didn't have a name. The doctor was Cliff Atwood.
Okay.
He moved up to the Conroe, out to the country, kind of semi-retired.
Got you.
And I took over a little small 800-foot, back in those days we called them a cottage practice. Because it literally looked like a little cottage you would see in the woods, a little wooden building and with a little carport on the side.
Nice.
And it was wonderful. And we've been there now almost 30 years. And, I'm seeing grandchildren of the patients that I started seeing back in 1990 or 92 when I took over.
Yeah.
So it's been a wonderful trip. But then along the lines as we grew, we went to a bigger building, another location there on Spencer Highway, and now over in our building on Fairmount Parkway. We decided we would brand. And I have to give the branding credit to Kim. That was her idea. I don't know if you want to share your thoughts on that.
So literally, we were just sitting in church one day, and something just struck me, and I looked at him, and in the middle of church, I said, we need to name our practice like what our core beliefs are, and pretty much God is our core belief. It's certainly, the crux of who we are. And he said, all right, we'll do it. And the reason I say that with hesitation is we were tossing around having some different names like Agape Dental and just some type of biblical type names that said that we were Christians. And we had some friends say, oh my gosh, that's great. Do that. And then of course we had some friends say, don't do that. You're going to regret naming it, and so for probably a year, we just went back and forth on, are we going to call it, we thought about Stewart Smiles. I can't even remember some of the other.
Dental.
Yeah, we had lots of different ones. Okay. And finally I said, you know what? what do we want people to know that we're all about? What's our main
Yeah.
thing? Are we about storing up piles of money? Or what are we about? No, we want to be, and I stole our tagline straight out of, I don't even know, where was it in Colossians? It's a verse in the Bible, something like that. And it's basically compassion, kindness, and gentleness. And I said, that's what we're about. And we're that way not only to our patients, but probably first and foremost, we're that way to our team. Our team is real important. We try to have compassion and kindness and gentleness. And we constantly, when we're in meetings, we're constantly reiterating that, well, you know, is that kindness? Is that what we're practicing? And that's really, so anyway, I just said we need to name it Blessed Dental, and it might get us in trouble. People might not like it, but it's what we need to do. And he said, you got it. And so we moved forward. Honestly, I think that we lost some business because of it, because people thought that we had sold it and it was a different company. So people that have been coming to him and loved him, you know, for years, they were like, well, I guess they sold it. So we kind of had a little bit of a bump going through that, but now we've got the DBA, and I think we've settled into it. And
well, it's who we are. You know, there's so many people I hear every day. I'm scared of the dentist. Nothing personal, doc, but I hate the dentist.
Yeah.
And most of the time, that relates back to an experience they had as a child. And, you know, maybe the dentist was not the kindest or the most gentle.
Yeah.
And so our mission is to try and change the view of what a trip to the dentist is.
Yeah.
Regardless of religion, you know, we treat anyone and everyone, of course, but we want to do it with compassion, with kindness, and with gentleness. And if we can do that at the end of the day, we've had a successful day.
Yeah. And it's interesting that you mentioned the bad perception of the dentist as a kid. So I always wondered that, because that's such a societal trope, I think that's the term, where just everyone always thinks of, as a kid, I don't want to go to the dentist. As a kid myself, I don't think I really had that problem. The dentist I had up in Connecticut had like this treasure box. And all I could think was that treasure box. I was like, I couldn't wait to get my reward for being a good kid. I was like, yeah, whatever you need to do. I'm so psyched, because they're like, you could take 2 items. And I was like, oh man, I'd be thinking about like what those items are gonna be. So I never had a bad experience, but people, like you said, just have that. So what do you think? What do you think is the situations or the reasons why kids get scared?
Well, there can be several. One is, like you said, the societal mentality.
Yeah.
What do you say? You have to do something that you really don't want to do. What would you say? I'd rather
have I'd rather have a root canal.
A root canal.
Yeah.
Oh, yeah. See, but I'm not in that mindset. I'd rather have
a root canal. And that's just kind of, you hear that all the time.
Yeah.
And so if you hear that, well, then what are you going to think?
Right.
Root canals must be terrible.
Yeah.
If they'd rather have a root canal than whatever.
Yeah.
And so for some kids, for some even adults, before they even see the dentist, it's there. And so again, our goal is to change that perception. You know, it doesn't have to be that way. And by the way, it's really good to hear that the treasure box works. We were able to manipulate you into liking us.
Oh, I didn't know you guys have a treasure box too. I didn't even know that.
And you know what? If you're good next time you come, we'll let you choose 2 prizes.
I always tease and say the kids love our treasure box. We've got some awesome toys in our treasure box. But then I have adults who go, well, I was good. Where's my... So one of these days, I'm going to get you a treasure box. I'm going to put like dollar lottery tickets and maybe some of those little tiny airline bottles of alcohol, and like, you can get a
maybe little hand sanitizers.
I would be looking
COVID
forward
masks.
Okay. Just for you next time, Roger. Adult treasure box. You got it.
I can't wait. You already know I've been thinking about that. Now I'm like, oh man.
So I'm curious about something about you. You said that you did not have a fear of the dentist, really.
Yeah, I don't remember.
So my question would be, because I think one of the reasons why people are afraid of the dentist is because back in the 40s, 50s, it was pretty barbaric.
That's true.
And we still have parents that went to the dentist in the 40s and 50s. I don't know when, before I was born in the 60s. And it was uncomfortable then. And so that's what they remember. So I think a lot of times you transfer that to your kids. So were your parents afraid of the dentist?
I don't think so. I mean,
No.
I'm trying to pull back. I don't think so. I feel like my dad was. I'm trying to think back. So my parents did divorce when I was 6.
Okay.
So I think the majority of the times I went to the dentist was with my mom, and I think she was fairly positive about it. Even if she wasn't, she always kind of kept everything together. Kind of to go on a side story about that. When I was 6 or 5, I think, my dad had left for work, and I was like so excited. I'll be so excited for the most random things. I was a weird kid. I'd be so excited for bath time too. So I was running around the corner, had like my just army of dinosaurs, because obviously, if you guys want to talk about dinosaurs, I have a lot of knowledge, obviously. So I was running around the corner. I know, yes. So I was running around the corner, and I hit head first into the side of the wall, split open my head. I have a scar that's still here. So my mom tells me that story because she was like freaking out, but she was like, didn't want to like have me freak out too, because that wouldn't have helped the situation. She's like, oh no, it's okay. And then on the side, she's like dying inside. And she told me, she brought me to the emergency room, and she kept composure, brought me there, and then she remembers hearing me crying because they had to do the stitches, and she broke down after that. But for the most part, my mom just has always kept it absolutely together, and I look up to her for that. So thanks, Mom.
Nice.
She did you well on that, because if she'd have fallen apart, you would have fallen apart. And I think that's a lot of times in the dental office, that's what happens with kids. If parents are freaked out and scared, the kids are going to be freaked out and scared. It's just natural. It's a transference thing. It just happens. And then if parents are confident, this is so fun, this is so great. And we like to get kids before they even have teeth, believe it or not, to come in, and we just call it a happy visit. We want them to sit in mom's lap in the chair, and this is so much fun. Isn't it awesome going to the dentist? Just like your mom. Come on, Roger, it's so much fun, the treasure box.
I know, right?
And they love it. And I mean, we'll have little 2-year-olds that'll come in, and they'll be like, we don't let them cry. If they cry while we try and look at their teeth, we back off, because honestly, at 2 years old, they don't have a lot of charter for us to, any. And so what's super important to us is that we raise people. We are raising adults that love going to the dentist.
Oh, that sounds amazing. Yeah. And you were saying too that.
And we got some happy gas too.
Hey, now that's for the patients, not for you.
We're going to be blessed and we're going to, you guys have this beautiful office here, ping pong. It's so inviting. I want to put a margarita machine in the waiting room. How inviting would that be?
That would be. You know how many people you would get?
I know.
You guys need to implement that.
I agree. I bring it up at every meeting, and they squash me. I don't know. One of these days.
Dr. Come on now.
I'm all in. It would just make me jealous because I'm working. I can't enjoy it.
Right.
So maybe after hours.
There you go.
I think you're on.
We're onto something there.
And then you'd have some people who had a few too many, and they'd be really blessed.
Yeah. That's right. I like it, Roger.
But yeah, you're saying that generational. It seems like you're having generational people come in, and that I think that's what's probably doing it is people have such a good experience with you guys. They want to bring in their kids. They want to bring in their grandkids, so on and so forth. One last thing. As a kid, you're going to have traumatic experiences that kind of mold you, but good experiences mold you too. Now that I think about how I react and I go in, I think because I was wanting to be good there, and that like I wanted to be good so I'd get toys, like that's carried over, because I'm like, I always wondered why. Like I'd go to the dentist and I would be like, I need to shave. I need to get like done up, like, and I'd always be like, whatever the dental hygienist is like doing everything, I was be like, everything okay? Am I doing it right? Like I would be worried about if I was a good patient, because I guess I was thinking in my back of my mind, I'm like thinking about that treasure box still.
See, we need more patients like you, Roger. We like you.
Hey, you guys do great work.
Unless you
Thank
like
you.
your hygienist, your dental hygienist, and you want to eat an entire box of Oreos before you come in.
Oh my god.
Because you want to make her, stay there a little longer.
Oh my god, I can't even think that. Speaking of eating with dentistry, so I always felt like for the longest time you couldn't eat way after, but I think that was just because they were putting fluoride on.
You're spot on. Yeah, you're spot on. Mm-hmm. So when we apply fluoride, which is great because it hardens the enamel, reduces the incidence of cavities. Yeah. For about 30 minutes, if you cannot eat or drink, the fluoride will be incorporated into the enamel better.
Oh,
so it would not have hurt you to go out and have a Big Mac, but would have wiped the fluoride off and you would not have gotten the maximum effect.
Right. Probably in general, eating a Big Mac is going to hurt you overall. Got you. Because I was so confused because I remember, at what age do you stop giving fluoride to kids?
So that is a great question, and it brings up a whole nother kind of a sore spot with me.
Okay.
Because we have become a nation that's kind of insurance driven.
Yeah.
And one of the things we'll hear is, well, we can't do that. Like, well, you can do anything you want to. They're your teeth.
Yeah.
Or it's your body if we're talking medical.
Right.
It's just that insurance has decided they're not going to cover that. Okay?
Okay.
And so what we do is we look at the risk factor for each patient. And we consider it a high, a medium, or a low. And so if you're a low risk, maybe you've never had a cavity and you're 50 years old, maybe it doesn't make sense to apply fluoride and do that extra expense. But if you are prone to giving cavities, maybe you've had some recession, you have some exposure of the roots of your teeth, then you might be a high risk, and fluoride might make sense regardless of your age.
Okay.
So excellent question, though. I'm glad you brought that up.
Yeah, I never even understood it because I remember even hearing of that word. It became a topic of how good is your water? Like, is there enough fluoride in your water, and is it fluoride deficient? Are you a fluoride deficient kid? And so it was always very confusing to me. So I think that's another reason why I always like coming to the dentist, because I don't know what I'm doing. Well, I know what I'm doing wrong. I know I'm not brushing at night enough, but I don't know any of this. And it always felt like I could just come in, especially you guys, obviously, and just sit down. And I'm like, all right, let me know what's good. Let me know what's bad. And you guys were always super upfront about it. And that kind of leads into like my wild story, because I know probably if I went to another dentist, I would have veneers now. I know you guys were, I believe, out on vacation after this. So I'll tell this kind of crazy story. And then you could probably tell me what exactly had happened during that time.
Okay.
So I was in Vegas, and
every good story starts with, so I was in Vegas.
Exactly.
I just want to know the exact amount of alcohol that was involved in this story.
It was a lot. It started out as not much. I was out there with two of my best friends, David and Matt, and we're like, you know what? This trip is going to be like a relaxing trip. Like, we're going to play some poker, play some blackjack, go to the pool, eat good, not be too crazy. So this new club opened. So you already know where this is going. And
we have Vegas and we have a new club.
Yeah.
I can't wait for number 3.
Our friend Angela was an event planner, so she was amazing. And she always had the inn. So I think I want to say it was like Lights or One Oak. I don't remember the exact name. And we went there and we got some alcohol. We're like, you know what? We're going to chill. We're going to have a good time. And there was a bachelor party right next to us.
Uh-oh.
And they were like, they left early to go to a strip club. And they're like, hey, you want to come? And we're like, no, we're good. But they had all this booze left. And they're like, well, you can't waste this. And I was like, they're right.
Yeah.
We cannot waste.
It's your duty as a human being.
Exactly. We cannot waste this. So earlier in the day, in the morning, I had been running a lot that time. I know we talked a lot about running. And my buddy Matt was like, you're trash. I could beat you in a foot race anytime. So we're like, we'll figure that out. Well, cue drunk me and him bringing that back up. And we're coming out of the club, and he starts running and is like, "You can't catch me." And we're pretty much on marble floors and dress shoes.
And what is the blood alcohol level at this point?
I don't know. I don't know. And I go straight after him, and there's a curve. He makes the curve. I am not lucky enough to make the curve. I slip, and I'm laughing. So my whole mouth is open. And I hit dead onto the edge with my two front teeth. And it cracks from the middle down. And I think it cracks one other one.
I just want to point out that there's a pattern here because your first story had to do when you were younger. I think you ran into a wall. And now you're in Vegas as an adult, and some things just never change.
I am very reckless runner.
I'm sorry, Roger. I'm just having fun at your
Let's just state for the
expense.
record, you like to have fun.
I like to have fun,
into
and
things.
apparently I like to go fast. And sometimes I don't make a corner.
So tell us what you have your teeth are broken.
Did you
Yeah.
call your mama and she said, calm down?
I did not because I was too ashamed. I actually, I have to give props to my stepmom's dad. He was the only person I knew out there. He lives in Vegas, Peter, but it was a holiday weekend, so we couldn't even find a dentist. So there's nothing I could even do. So it was just it was like I had to chew on way deep into my mouth because as the moment anything hit it, it was like absolute searing pain. So I came into you guys. I forgot the doctor's name that attended me, but it was like, well, shoot, I don't know if you wrecked it so bad that we're going to replace it. Basically, they want to do a root canal, but they weren't sure if it would actually work and that the tooth would hold. I have no idea what that means. All I know is that at the end of it, there was a lot of drilling. Sticks were up there. And they were able to rebuild everything. And it's actually funny because that's the tooth. So I chipped that tooth on salad 3 weeks ago, and that's finally going to be coming back in.
Now, was that the first time that we saw you, or had you been in before?
I had been in before.
Okay.
I had been in before.
Well, you have a beautiful smile.
Oh, thank you.
So, you're welcome. And I'm sure
Thanks to you.
Okay, you're kind. You're kind. So I'm sorry you had that experience, but it sounds like in the end, it turned out good.
Yeah. So,
Good.
yeah, it did.
When you were on the plane ride back to Houston, and the stewardess, what do you call them now? What's
The flight attendant.
Thank you. Did anybody ask you? Was it visible? Was it noticeable?
It was very visible.
You have such a big smile, a broad smile that I would think a chipped tooth would be noticeable.
I did have multiple people talk about it. I had to relay that story multiple times. I did have a few girls say it was cute and I looked like a vampire. So I was going to take that compliment. So yeah, a lot of people definitely talked about it. It was not easy to hide. And that's an interesting thing, right? That's how important dental hygiene is, right? I think you sent me a meme a while back where it was a guy missing a tooth. Yes. And it was like, I bet you also didn't realize he had no eyebrows.
Correct. Yeah.
Because smiles.
That's what you
notice.
You see. Yeah, you notice the smile. Yeah.
But what happened during so I had no idea what they did. I was just like, sounds good, because I wanted new teeth. What did they do to fix my teeth?
So I think when you came in, you may have seen Dr. Cruz, and what she did was just magic.
Okay. She just waved her wand.
That was it.
The wand from the treasure box.
Yes, seriously, on a tooth that's broken and painful like that. And I wish I had known we were going to talk about this. I would have looked over your record so I could be more sure. But it sounds like what was done was a root canal.
Yeah.
Maybe a post in there. That's as you called it, a stick.
A stick.
We like to say a post.
A post.
And we would never put sticks in anyone's mouth.
Yeah.
So we put the post in and then shaped the tooth and made a crown.
Okay.
Crown's probably made out of some sort of porcelain. Or maybe a zirconia material, which was one of the new materials we use. And they're beautiful and they're very strong. So I'm glad you were able to be helped.
And you guys referred me to go do additional work at the
endodontist.
Endodontist.
Mm-hmm.
So what is an endodontist and how did they help me out there?
Sure. So an endodontist, if you break that down, endo and dont, right, inside the tooth.
Oh,
so,
okay. I was like, those are two words I also don't know.
Okay, so an endodontist specializes, usually we think of root canals.
Yeah.
They also may do some little surgeries around the tip of the tooth. And that was probably why we referred you, even though we do quite a few root canals. If we were in question as to a long-term prognosis,
Yeah.
then the endodontist is a board-certified dentist that does nothing but treat abscess teeth, do root canals,
Yeah, I
things
think
like
that was one of the big reasons because who was the doctor again?
Dr. Cruz?
Dr. Cruz had said that she was like, I believe we can do this without a veneer. Because she said the root might be dead or it might die. And she said, we're going to do everything to make sure that doesn't happen. Because A, it's way more expensive, and B, you get to keep your tooth.
Right.
I
And
think
if a
that-
root dies, it'll turn dark too.
Oof,
So
that's weird.
yeah.
That sounds really bad.
Nice
You know, it's
black.
fixable.
Yeah.
It's fixable.
Yeah, there could be worse
Yeah.
problems.
And by the way, when I chipped this, I could feel it almost all the way up to the root too. It was pretty. It doesn't hurt now, so which is a good sign, right?
So what you're saying is you're going to make us work really hard this time.
Yes.
No, we're just not going to let him go to Vegas anymore.
Yeah. No more. Well.
Well, now, I think what we need to do is go with you to supervise.
Yes. Hey, a chaperone is probably not the worst thing that I could have in my life. But yeah, great work, and I really appreciate that guys. And I think that's maybe another thing that people have the fear of too is they don't understand what's going on.
Sure.
Fear of uncertainty, right? I did mention I probably don't do enough at home, and I know I always get pinged on why haven't you flossed enough, and are you brushing at night? I think I have to have this out there because this is probably one of the best potential pieces of information anyone can know, because it's way better to maintain your teeth than have to go see you and you have to fix the tooth.
Sure.
So I'm a young little kid growing up. What are the habits I need into adulthood that make sure my teeth are long and healthy? My teeth live long and healthy.
So you mentioned flossing.
Yes.
And in the dental world, we have a joke that says, you know, the two biggest lies are the checks in the mail. And yes, doctor, I flossed. But having said that, you want to talk about kiddo hygiene?
Well, so I think that I always say this: if I ever become president, I am going to outlaw handheld toothbrushes because we have the technology these days.
Yeah.
With these, I'm sure you have an electric toothbrush. Roger, I'm sending you one after
I
this.
did. I did. I haven't replaced it yet.
Okay. So, I mean, a handheld toothbrush is certainly better than not brushing. They're great. But we have such technology out there now with these electric toothbrushes. They're fabulous. Using ultrasonic, the same type of cleaning systems that we use in the office to clean your teeth. So they're great. And I always tell people, like I said, if I became president, I'd outlaw handheld. Everybody would have an electric toothbrush because you could essentially put us out of business. We'd have to find another way to pay for our kids' college.
Yeah.
Colleges.
Colleges, multiple.
Multiple colleges. And then I love the little floss sticks. You know, those little sticks of flossing. And I don't even, by 8:30 at night, he can tell you I'm ready for bed. I don't feel like flossing. But I keep those little floss sticks in my car, in the center console of my car. At a red light, I'll floss. And so I tell people, you can floss every day. Just don't do it at night before bed if you're like me and you're tired. Those floss sticks just make it real easy.
Yeah.
So technology-wise, things have gotten a lot better.
So ditch the old school floss.
Yeah.
Replace it with the handheld.
Well, I mean, not necessarily. Either one. Do you know what the best floss and toothbrush is really on the market?
No.
It's the one that you will use.
Such a dad.
I know.
Dad jokes.
I am a
coming
The
dad.
amount
here.
of dad jokes, I think we're at like 7 or 9 of them. Dr. Mom.
Can we keep a ticker? We can just count them all.
I bet we could keep it. You know what? I think post-production, we can get
Edit me out. We'll just have Kim.
We'll have a dad joke counter at the top.
Yeah, that's funny.
All right, perfect.
Please.
But seriously, the reason the floss sticks are great is because they're easier to use, so you're more likely to use it.
Right.
Okay, from a technical aspect, the old style long floss probably does a little bit better job.
Yeah.
But if it's sitting in your drawer or on your sink, then it's not doing any job.
Yeah.
And so, like she said, you put the floss sticks in your car, do them at a red light. You can put them on your coffee table.
Yeah.
Floss while you're watching the news.
No,
so
we don't want to watch.
We don't
while
want to
you're
watch
watching
news
Netflix.
either.
No,
Kim's anti-news these days.
Yeah.
But-
Oh man, it's
But
That's-
seriously, whatever you will use, that's what I would recommend.
Yeah. Yeah. That sounds good to me. Yeah, I think those handheld floss ones, disposable ones. I always remember the first time I saw them was there was a friend of mine who ran a underground poker game in Houston. I won't say his name for implication reasons, but he would have a big bag of them, and he'd just be doing them while he's
Really?
going by the day. Right after he ate, everything be handing him out to people.
Give
Very-
him our number. We want him as a patient.
I think he's a little far away, but I'll ask him who his dentist is.
He's gonna be our dream patient.
Yeah, so he'd just be doing that. So I remember that too. And they make ones that are mint flavored.
Yeah.
So
yeah.
not only now you have an incentive to taste good too.
Mhm.
But what brand of electric toothbrush would you say is the best for the dollar?
So I like the Sonicare. I do,
Okay.
and we don't sell them in our office. I always tell people go to Amazon. They're cheaper on Amazon than anywhere else. You can get a Sonicare for $40. And Sonicare. It's by
Care.
Philips.
It's made by
Sonicare.
Philips.
Mhm.
Philips, okay.
Probably the most expensive part to it is the little toothbrush heads you have to buy, and
Okay.
and they are probably they're more expensive than a regular toothbrush, so people tend probably to not change them out as often as we should.
Yeah.
But yeah, I like the Sonicare.
And what about so two other things that are kind of like ancillary. Well, obviously toothpaste.
Oh wait, when this goes famous, can I get Sonicare to sponsor me on that and just send us millions on that?
Yeah.
Okay.
Oh
great.
yeah,
Got
100%.
Got it. We said
Exclusive deal with Blessed Dental, Sonicare. I'm sure we can cut in a commercial here.
Right. Sponsored by.
Let us know, Phillips.
Who are you sponsored by anyway?
Well, technically, right now,
Eastwood Energy.
sponsored by Eastwood Energy Group.
There you go. I just
Yeah.
gave you a plug.
Thank you so much. Thank you so much. And so, if you're looking for electricity needs, Eastwood is energy your way. See, I even have a tagline for it.
How long have we been using you?
Oh,
4
man.
years now?
It's been a
yeah.
while. So yeah, I guess.
And every year we get a little better deal?
Hey, I can't always promise a
I'm
better
loving it.
deal, but
That's awesome.
it was we met I think 2014.
Is that when?
2014.
Wow, time
originally.
flies.
You guys were with Green Mountain, I recall.
Mhm.
Green Mountain, and then I think you guys are with NG right now.
You're right.
Wow, good memory.
Yeah,
Out of all your clients, you remember what energy company you put us with.
yeah,
I'm
yeah.
impressed.
Yeah, I can't remember your rate, and I definitely probably don't remember the exact end date, but I kind of you have the experiences because whenever you're looking for, I'm not trying to. It's about dentistry today, but real quick, whenever you're like have a client and you're always kind of looking at the market for them, I think it's easy for me to remember because I could almost remember the experience of, okay, that when I first talked to him, it was this day because it was around that time when the market came down and this is when, so like I have a story of how that contract happened. So I almost have a story attached to it because before NG, you guys had Think Energy, I believe.
You just have a good memory.
Yeah.
You're one of those.
No, I
people.
don't. I know I don't. Ask anyone else.
Well, our energy costs lower today than they were because when we first moved into our house,
Yeah.
like our electric bill was like crazy,
What-
$500 a month.
What year was that?
And you do our businesses,
That's 12
but you
years
also kind of pick our home
Yeah.
too. Yeah, it was 07.
07. Okay.
We
So
moved in at 07. Our electric bill was like $500 a month or something, and now it's like $2,
yeah.
maybe $3.
So in general, deregulation happened in 2002, and for a long time, just the pricing wasn't as good as when it was unregulated. Only I think in the last, I want to say 4 years, have over that time the average kind of has been better. So I think it was a very new market. There wasn't really a whole lot of like competition as much as there is today. And also in 2008 that time frame, 2008 specifically, we had a jump in natural gas pricing, which, because the grid was so significant in natural gas for production compared to what it is today, that had a huge spike. 2011, similar situation. But for that same reason, that's why 2016 was one of the biggest dips. So it was because of the fact that the industry is so new. Texas deregulated market is only 18 years old. So it was.
When you say deregulated, do you mean like there's no longer a monopoly? Like there's not just one,
Correct.
like you can shop it is basically what you mean?
Correct.
Okay.
So not all states are deregulated. I don't know all of them off the top of my head because we focus on ERCOT. It's the majority of the Northeast, and it's down here in Texas, of course, and they have Illinois, Maryland, Pennsylvania, Ohio. But I think that whole part of Northeast, because it's New York, I think Delaware is too, Massachusetts, Connecticut, New Hampshire, Vermont, Maine. I feel like I'm missing
What I'm
one.
hearing, though, is that you're being very humble and attributing this to the market. But what I'm seeing is that Kim found you a few years ago.
No, he found me.
That
He found
since
me.
then, our energy rates have gone down. So I'm appreciating Roger and Eastwood right now.
Well,
that's the correlation
You
I
keep
see.
the smile. What's that?
Well, because it's deregulated, I guess I'm assuming that's why it's deregulated. I actually had somebody call me at the office. I don't know, what was it, like 6 months, a year ago or something, and I called Roger and I was like, what's going on? They told me that Roger no longer is doing this and that I need to sign on with them. And Roger was like, you're being scammed.
Well,
Do you remember that?
I don't know if I used the word scam,
Oh,
but yeah, no. When I left the old company, all the customers that I had serviced there, all that information was still there. So,
Okay. So that's what
yeah,
happened there.
yeah,
I gotcha. Okay.
Yeah. But now, however, I swear this will be the last thing non-dentistry. A little bit of a service announcement, scam-wise. Centerpoint for the Houston area, Encore for the Dallas area, and then if anyone's listening from South Texas, AAP, CPL, they will never call you saying that they're going to disconnect you and they need payment. That is always up to the retail service provider. So the scams I see is someone will say, hey, this is, David from Centerpoint. I'm calling because you guys are $733 past due and we're going to disconnect your power tomorrow. We wanted to just give you one last chance to pay it.
They will never call you and do that?
Centerpoint will never call you.
See, I would just assume Kim forgot to pay the bill again.
Could be
And that's what they rely on. But the other thing is too, they'll always ask for a wire, or some other cash transaction like that,
yeah.
or like a Western Union. So
Okay,
it's
good to know.
it's good to know. And basically anyone that has that happen, I would call your broker, call your rep, and just double check. Because even if, that's still going to be back of your head if you're like, no, this is a scam. Oh, well, maybe I'm wrong, Always call it. Your rep will always know. Your broker can always pull it up. But the way they'll let you know about disconnects, most of the time, if you don't have a good account manager, is that they'll send, the rep will send you something in the mail to say you're going to be disconnected.
We've got you on speed dial, buddy.
Yeah, thank you. Yeah. But yeah, hey, thanks for letting me plug.
No, it's fine.
Enjoy.
So back to dentistry. I know back to dentistry. Back to dentistry with Dr. Bob and Kim. COVID, obviously. I remember I talked to you, Kim, because I was asking how everyone was doing. I was like, hey, how are you guys holding up? I had no clue. And then it didn't click to me until you're like, I'm pretty much, we're unemployed right now.
Yeah.
And so I was like, oh yeah, obviously that makes sense. Clearly from what we've learned, it's transmitted most likely from the mouth. And you guys are probably the profession that is the closest to the mouth on a daily situation. So for anyone that's scared to go back to their dentist, or they're like, you know what, like I just am going to leave that alone, because we've also seen on the news that they say dentistry is the highest risk. How has that affected you guys, and what are the precautions you are taking to make sure that it's a completely safe area? And one last thing too, I did notice what you said earlier, because I mistakenly went for a handshake, and then we did the elbow bump, and Dr. Bob had said, look, we have to be way more careful than anyone else, because of the sheer fact that we're so close to people on a normal basis. So what's Blessed Dental doing to make sure that everyone is safe?
Sure. You sure you want to get us started there? This could go on for hours.
Yeah, no, good. Dad joke number 73.
And I will say before he launches, because it's all on him.
Yeah.
My eyes glaze over and I go off and turn on HGTV or something, because he is so committed. He's on the CDC's website, and he has belongs to a dental group, a DEO dental group, and they're constantly. So my 8:30 bedtime, and he comes to bed about 2 a.m, especially when this all hit. I think it's getting a little easier now, but when it all hit, like March and April, he was just scrutinizing and trying to figure out what we needed to do, because it was
fun
terrifying.
that she just said that. This is great. Because
it was scary.
What time did you go to bed last night?
Oh, what time does it get dark?
8:39.
Sounds good.
I was up till past midnight, and the reason for it is CDC actually had new recommendations posted just yesterday.
Oh, okay.
And the main thing, like I said, we could talk about this for hours. I spent countless hours. I estimate for every hour in the office, I'm spending 2 or 3 trying to think about keeping people safe and preparing, and it's pretty exhausting. Although I love it, I wouldn't want to be doing anything else. But the newest thing is that the temperature was 100.4 that we used as our threshold for, if that's a little too high, then that's a symptom of COVID, and maybe we should postpone anything elective. As of yesterday, that's now 100 even. And so little bitty nuances in the recommendations and guidelines are changing almost daily that we have to keep up with.
And you say you basically would put the kibosh on anything elective. So that means that if someone might have symptoms, but it's an emergency procedure, you're still going to do it.
So great question. So let's go back in time a little bit. March 16th, the American Dental Association put out a recommendation that all dentists postpone elective treatment and only see patients for emergencies. They further recommended that we not close completely, because some dental offices did, and certainly that's respectable. However, if there's no dentist available, then patients who have a dental emergency will end up in the ER.
Patients who go to Vegas and
Well, 2 problems with that. First of all, the ERs are already at capacity or more trying to care for life-threatening issues, for instance, COVID. Secondly, if you think you're at risk of being exposed in a dental office, your risk at an ER full of COVID patients is much greater. Okay, so if we could, and this is going back to March 16th, if we could stay open on a limited basis for emergencies, that was significant. And so that's what we chose to do at Blessed Dental. Fast forward then a couple of months, and those things change, those guidelines expire, and the prevailing thought is, okay, we're going to have to kind of find a new normal. Okay, the curve's starting to flatten. Let's start seeing these elective procedures. Okay, well, there was some discussion, what is elective? So the American Dental Association, with their first definition, came out, and elective was uncontrolled bleeding and fractured bones. And so, my thought was,
I clenched up just hearing that.
I don't see too many people with fractured bones. If you're in an automobile accident and you're bleeding uncontrollably, you usually go to the ER, not to the dental office. So that really didn't give us a lot of guidance. And so those guidelines changed almost by the day over the next few weeks. And so then we decided maybe, people who have infections and abscesses and are in pain would qualify as emergencies. Okay, and that was really left up to the individual practitioner. What is an emergency?
Right.
For me, I have a hard time leaving anyone in pain. So if you call and say, I'm in pain, my question is, how soon can you get here? I'm going to get you out of pain.
Right.
Then there's the obvious things like veneers and braces. Those probably aren't emergencies. We can do those once we get past the COVID.
Right.
Okay. And so now that we're back in the office and we're seeing elective things, you're right. If you look at the risk factor, and it's not so much to the patients, it's to the dentist.
Yeah.
We're listed as the number one risk, even above those physicians in the ER who are seeing those COVID patients. The reason for it is we are directly working in your mouth, but we're also using our handpiece, which you would like to call drill, but we don't use that word in our office. We use our handpiece.
Yeah.
And then the ultrasonic cleaner that we clean your teeth with, those create an aerosol. And so now you have this fine mist that could be in the operatory that could be potentially carrying virus. Okay.
Wow.
The thing about that is this is not really new. I grew up as a dentist in the AIDS scare. And so we started back then using something we called universal precautions. And all dentists should be doing this, whether it's COVID, even a year after this pandemic, we should continue.
So that was back when they believed AIDS could be transmitted through saliva.
Well, you know, it's interesting you say that. I remember my first lecture on AIDS. I was in a microbiology class, undergraduate student.
Okay.
And at the end of the course, the very last day, the professor says, there's one other thing we need to talk about. It's called acquired immune deficiency syndrome. So this would have been in about 83.
They just dropped that
And
bomb.
we really don't know much about it.
Yeah.
And so she gave us some, high-risk groups. And of course, over the next few years, we learned a ton.
Yeah.
And so even knowing that AIDS is not spread other than usually through body fluids, we still use universal precautions. There's influenza, there's the common cold, And so we've been at risk of all of these things for many years. So to me as a dentist, if I back out and say, oh no, I'm scared, I'm at risk, that's kind of like the soldier taking his paycheck until war breaks out and then he quits.
Oh, yeah.
I've committed to help these people.
Yeah.
And yes, there is risk. I'm going to do it anyway, but I'm going to do everything I can to mitigate that risk to everyone, to the patient, to my team, and to myself.
Yeah.
And one of the things that is nice about it with dentistry is that we are able to screen our patients like a lot. If you go get a checkup you're just going for a normal checkup. I would imagine they're screening as well. That if you are having COVID symptoms, we just say, okay, wait a couple weeks before you come in for that cleaning, and that helps a lot. That we are able to pre-screen those patients, knowing that they are symptom-free, that we can bring them in at that time.
Well, and that may be a large part. Even though we are supposedly the number one risk, there has yet to be any case that we know of where a dentist or a dental team has contracted COVID from a patient, or vice versa, a patient from the dental team. And so that's kind of gives me a little peace, and hopefully will give the listeners and patients out there peace. We want to be careful. We don't want to do things that are dangerous. On the same token, we all know that postponing treatment, it just gets worse. Right. And there's been some research lately. COVID's brand new. It's unprecedented, so we're learning. Yep. But there's been recently some research that indicates that a patient who has gum disease, for instance, or an infection of some sort may have a bit of a compromised immune system and might be at higher risk for contracting COVID.
Oh, yeah.
So we kind of have to think full cycle here as to what makes sense.
Well, I mean, I think we take dental hygiene for granted. It seems from what I had learned as a kid, like randomly learning about the original historical Egyptian culture, you'd hear like people who died from a cavity. So I was like, what? So technically, if you have something go untreated for a while, it could get into the bloodstream, right?
It absolutely can. An infection left untreated. We have some places in our neck, that we call the danger spaces. And if it's a very simple thing. If we take our antibiotic and get the tooth treated, it's almost a non-event. Yeah. But unfortunately, if we neglect it, it can spread down through our neck into our chest and even become life-threatening.
Wow. That's
Just yesterday, we had a patient in who had a tooth broken off at the gum line, and he said, it's not bothering me. It's been this way for years. Literally, his tooth has been broken. He broke it years ago, and he said, I kind of feel like, why am I bothering to take this out? And after he left the room, he said, Kim, tell me, do you think I should take this out? And I was like, oh my gosh, yes, totally. You need to take this out because what you just said, believe it or not, it can become infected and get into your bloodstream. Well, when we took the tooth that it was in 3 little roots that he took out, and at the end of one of the roots, it had a little abscess on it, and you could see the abscess, and I showed it to the patient, and I said, this abscess would grow and infiltrate your bone and actually eats away your bone, and then it hits your bloodstream, and once it does that, we all know, getting sepsis is dangerous. So I said, you absolutely did the right thing by taking this to that. So we can't neglect our dental health. It's all connected to whether we're eating healthy and whether we're taking care of our teeth. It's certainly all the body and connected.
A lot of research indicating risk factors higher for all kinds of crazy things you wouldn't think of. Heart disease, premature birth defects.
Right.
That come back to, and we're not sure the link, okay? So we're not saying this is causative. But people who have gum disease, mouth infections are at much higher risk for a lot of crazy things.
Oh, that's wild.
Yeah. So we know that we need to get treated. How do you do that safely during COVID?
Yeah, that's true. And so obviously you guys sterilize everything. I haven't been in there. So in my mind, you guys are using maybe the plastic shields? Or what are you guys using for?
Good question. So can I take that bigger?
Yeah.
A little bit?
Yeah.
Okay, so if you're a patient and you're going to go see your dentist, how do you know that he's safe or she is safe? So some things to look for. The first one's really simple, and this follows ADA and CDC guidelines. They should be pre-screening. So coming back to the fact that, we're high risk, but we haven't had any incidents. Part of that, I think, is pre-screening. The dental office is at a convenient position of being able to postpone things, even though it's important. Most things aren't life-threatening. So if you have symptoms, that should be caught in a pre-screen on a telephone call before you're ever even in the office.
Right.
Okay, then it can be postponed. You can be referred to your primary care doc, get that taken care of, and then you can come in and get your teeth cleaned. So when you call your
don't
dental,
lie to your dentist.
Yeah, that's right. Well, when you call your dental office, they should ask you that series of questions about symptoms. And if they don't, then you might question, are they pre-screening their patients? And then that should be repeated when you get to the office. The temperature is taken. There's a lot of little things you'll notice that may be different. At our office, we put the clear screen up for the front desk lady. And, you see that when you go to the grocery store. So there's a lot of the waiting room should have either fewer seats or seats marked off. We have also put time in between each patient, trying to minimize the number of people that have to be in contact. As one's leaving and one's coming, we put an extra 10 minutes in there to try and accommodate for that.
And to clean the rooms too.
Absolutely. And then the mask you talked about, that's part of the famous PPE. That's a buzzword. Everybody's heard PPE these days, right? What is that? Well, in a dental office, it's either a mask or some good goggles. It's when I say mask, I mean a face shield or some goggles, a mask, gloves, and a gown. And
we kind of look like Darth Vader.
Yeah, we kind of do.
Yeah, but it's cool.
You're just coming in there like,
I am your father.
I've come to take your teeth. See, that would not.
Let's do that. We should totally do
No,
that.
don't scare the kids.
That's funny.
Remember, compassion. That's what you guys started.
That's right.
Well, yesterday, the same patient I told you about that we took the little root tips out, he was super nervous and he was asking me all kinds of questions. And we got the dad goat count going here.
Oh, this is my favorite.
He walks in the room and I said, hey, I didn't call you sweetie, did I? I didn't call you.
You probably did. It's
hey,
okay.
Hey,
I'll be sweetie. I'm Dr. Sweetie.
Dr. Sweetie.
Our patient here is super nervous, so just wanted you to know that. And he goes, "Oh, that's so great because I'm super nervous too."
I've
And
never.
he said, don't worry about it. I watched a YouTube video last night. We got this. So fortunately, the patient took off running. No, I'm kidding.
Yeah, I was going to say, hopefully they laughed.
You know,
That was a risky joke to make.
it is, but I do it all the time. It's an icebreaker with patients. I'm really nervous. I say, I am too. I've never done this before. But it's going to be okay
My
because I watched it
favorite-
on YouTube
my
last night.
favorite
It
one,
just
though-
breaks the ice.
I'm hijacking your COVID talk, but my favorite
Go ahead.
one, we were probably pretty newly married, and I am actually a teacher by trade. I went to school to be a teacher.
Okay.
In fact, I'm sorry, Mom and Dad, that you paid all that money to U of H because I taught for 1 year and then
Hey,
I
at
met-
least
I
it
met a
was
dentist.
in-state. It
That's true.
could've been-
That's true.
yeah.
Yeah, and public school. So I met a dentist who said, "Hey, do you want to work with me?" And so I never taught. But
Who was that?
I'll tell you later. I don't want you to know about him. I know anyway. And so one of my favorite stories when we were first working together, we were excited and we had this new practice and he was up there and we were up there on like a Saturday and he was putting shelves up and the phone rang and I'm like answering the phone and it's some guy who broke a tooth and I was like, well, we happen to be up here. Come on up. So he came up. Really nice guy, got him in the chair, got him seated and everything. I was like, okay, well, let me go get the doctor for you and we're going to, take care of your tooth. And he walks in with a freaking Black & Decker drill and he revs it up like this and he goes, I hear somebody needs some dental work. And he revs the drill and I was like, oh my gosh, this is
True
what I'm
story.
married to. I'm married to the dad joke.
I'm married to the dad jokes.
You were dad jokes before dad jokes.
I
You
know.
made dad jokes before dad jokes
When
were
my
popular.
kids started saying that's a dad joke, I didn't even know that was a thing.
Yeah.
I thought they were just telling me I was boring.
So you don't have to be a dad to make dad jokes, right?
No, you do not. I've been criticized for making a large number of dad
I
jokes.
love
You're going to make a good dad someday.
Yeah, I've been practicing with these dad jokes.
I love it. That's good.
Yeah, my dad too. Oh man, me and my siblings would give him a lot of criticism on some of the jokes that he would make. But I think that's part of the repertoire. As soon as especially if you haven't made dad jokes before, and then you have your first child, I believe it's part of protocol.
Yeah, they won't let you go home from the hospital.
Yeah, they're
without
like, all right, we
It's
need you
obligatory.
to. Yeah, they're like, we need you to recite some of these jokes.
Yeah.
Take them home with you,
Exactly.
practice them. This is your life now. You're not funny anymore.
You think you are.
yeah, you think you're hilarious, but you're not.
That's funny.
Well,
that's good.
well, is there anything else more to talk about though in terms of the care aside from the PPP? I know Kim went on a tangent there.
Sorry.
No, it's all good. I'm used to that. It was fun. It was fun. So COVID safety, I don't know if you have any questions. I think I covered most of
Yeah.
it.
We're all wearing masks, just like everywhere you go. We took it off for this, but
Yeah.
I am a firm
Well,
believer in
6
the
feet.
mask. That's right.
6 feet.
6 feet. Well, I sleep with him, so
Yeah.
that's okay.
Yeah, I mean, it's a legitimate concern
Yeah.
anywhere you go, especially the dentist.
Right.
However, the consequences of postponing dental treatment is also a legitimate concern.
Yeah.
And so I think that the dental office is safe if everything is done well and correctly.
Yeah.
And that it's okay and safe. And your listeners should know that it's okay. Not only is it okay, but it's wise
Yeah.
to go get their dental treatment. Just look around and make sure that all those guidelines that we as dentists are getting from CDC, and I counted it up, there's actually 10 different groups I could think of
Yeah.
that regulate us in some way. And I never remember them all, but there's the CDC and there's
Right.
the state board and there's, even the governor's office got together with state board and they were involved in the local health department, and it just goes on and on. But if the dentist is following all of these recommendations, then it's better for you to be seen than not be seen.
Right. That makes sense. Well, it sounds like you're absolutely on top of it.
Doing my best. Enjoying every minute of it.
Yeah, it definitely changes. Like you said, it changes like every day. I've really realized that someone made a comment about COVID in general. It's as if we're all living the scientific method right now, because it seems like we're just continuing to have different information, because it started out as something that no one knew about, and then doctors in general, or research analysts, not research analysts, but research doctors are basically trying to at breakneck speed figure things out more and more. And to me, it's, I hope that we learn a lot through this on how to handle things, because I doubt this is the last virus that we have to deal with. I mean, I watched some documentary and they said there's like millions of viruses that are just out there that we may not have contacted. But I know you'll be ready, Dr. Bob.
I appreciate that. I think, honestly, it's all about us caring about each other.
Yeah.
You know, if I care about you, whether I think that wearing a mask is going to help or not, I'm going to realize that it might give you some peace of mind.
Right.
Personally, I do think it helps.
Yeah.
But even if I didn't, I would consider Roger and think, you know, it might make Roger feel better.
Yeah.
Let's just treat each other, you know, with kindness and love and compassion.
Where you guys started.
Exactly.
The whole world could use what the world needs now. Is love, sweet love. Is it true?
True.
That's what we need.
True.
We really need it now more than ever.
Hey, sounds corny, but we definitely could always do with more love. I mean, it definitely, it doesn't hurt. But definitely what you're saying about people, if they feel a certain way, it's become probably a very psychological thing as well, in addition to the physical harm. And I think that's something very important, that if someone is going to feel more comfortable, even if you don't agree with it, but as you do, I completely agree with that as well. But if someone doesn't feel good, if they see you without a mask, like that's hurting their psyche.
Right.
You know, and I know, honestly, you can't always do everything specifically to be just right for everyone. But you know, if you're leading with empathy, you're always at least going to get it right most of the time.
I love
Well
that.
put.
That's great.
Well put.
I love that. That's awesome.
Hey, I'm just
Leading with empathy.
leading
Maybe that's our new
I like that.
go-to.
Yeah.
I like that.
I can't take credit for it. I originally heard it from Gary Vaynerchuk.
I like that.
I don't
that
think
a
he
lot.
said that exact line, but he really believes the future of business leaders and the future of leaders in general is going to be more based around empathy than anything else. Because a lot of sales guys, entrepreneurs, CEOs, the personality is like a shark, like very like get things done, you know, aggressive, high confidence, you know, at the top of their game, high performer. But I think long term, we'll start to see that the true leaders are someone who can, you know, look at every one of their 1,000 employees and think about that's a person too. So hopefully,
You know, my
see it.
favorite.
That is awesome.
You're probably
I
trying to
agree.
wrap things up, and here I'm just going to launch
No,
off.
we can
but
keep going.
I have to say this. My favorite my favorite go-to company, the company that I look to as far as like what we model our company, what we're modeling our company about, is Southwest Airlines.
Herb Kelleher?
Thank you. And I read
Gary Kelly,
his book is called Nuts. It's a great book. If you haven't read it, I highly recommend it. It's awesome. But what I love about Herb Kelleher, and people will tell you who've met him, will tell you he was just a neat guy. I mean, if you've flown out of Hobby anytime after he passed, they still have the "We Miss You, Herb" on their, you know, when you're getting your bags. But I love his philosophy, and his philosophy is so simple. He cares about his people. His people who work for him, not necessarily the passengers that are paying for those employees to be able to be there. That's his foremost thing, and that's the way I keep thinking is, you know what? If we treat our people right, everything else is going to fall into place.
Oh yeah.
So I mean, lead with empathy. I love that, and I'm sure, you know, if Herb Kelleher were here, he'd really be focusing on his people.
Oh yeah, it's right now it's Gary Kelly, I think, right? The CEO.
I don't know. Is it?
I think it's Gary Kelly. I could be wrong. I don't know if we can check that.
Fact check.
I'm sure you're right.
But Gonzalo is always there to get all the information. But I think it's Gary Kelly.
Yep.
Gary Kelly.
Yep.
Okay. Thanks, Gonzalo. And I remember I was taking, first of all, I won't fly anything else unless I absolutely have to.
Really?
Yeah, I love
I
Southwest.
do too. We do too.
Yeah.
Yeah.
And
We've got the little credit card that gives us the miles. That's
Same.
part of the reason why
That's
you do
same.
too. I love it.
I have a lot of miles now because I really haven't traveled that much.
Yeah.
But I was on a flight to Dallas, and I was talking to the what's the term again?
Yeah. What's the PC?
Oh, the flight attendant.
Flight attendant.
Yeah.
Well, I just couldn't remember it.
No worries.
And I was asking how everything was going, and they said that the commitment of the company was not to lay off any direct employees.
Oh.
Now I believe they did lay off some like kind of indirect contractors for customer service and stuff like that, but they were trying so aggressively to find every option, including getting people who are open to early retirement and so on and so forth. But as of the last time I looked it up, I don't believe they furloughed anyone.
That's fantastic.
And that's amazing.
That's not easy to do.
No, that for an airline during
Yeah.
this, that's absolutely insanity. And also another thing, a lot of airlines that were given the go completely filled up seats.
Yeah.
Yeah.
Southwest said they're committed to, right now they may go further out, but they're committed to the end of September, middle seat always open.
I like that.
So yeah, love that company. I'm absolute Southwest
It's a great
lifer.
company. Anytime we fly, too, my favorite question to ask them is, do you really like working for Southwest Airlines? I've never had one of them tell me
Yeah,
no. And there's usually a waiting list to get to work for the company.
yeah,
So I hope it continues with the new CEO.
yeah, he seems pretty sharp, man. So I see his stuff on LinkedIn.
Yeah.
I had some other questions, but you know what? I think I'm going to end it on this love note.
All right.
So thanks for you guys coming on. Once
Hey, it
again,
was a blast. It was fun. We
It was a
enjoyed
lot
it.
of
Thank you.
Once again, this is Dr. Bob and Kim Stewart of Blessed Dental. They have their location off of Fairmont?
Fairmont
Fairmont in
Parkway.
Pasadena, and then in Willowbrook, the location. I should know that. I think.
1960.
Well, they changed the name. It's called Cypress Creek Parkway.
Oh, okay.
Yes.
Cypress.
It's the old FM 1960.
Got you,
Yeah.
got you.
Brush and floss.
Brush and floss.
Or we're going to see more of you than we want to see
I
of
know.
you.
Right. So you can see
So-
me now, or you can see me
There
later.
you go.
Exactly.
The count. What's the count up to?
It's been a
now?
pleasure, Roger. Thanks
Yeah, of
for
course.
having us.
Of course,
Yes,
And remember, guys, if you do go, they do have a treasure box, so don't forget that.
Just waiting for you.
All right, see you guys on the next one.
Our pleasure.
Thanks.